Welcome to your week-by-week pregnancy video series, brought to you by Ultrasound Dimensions, Medical and Maternity Ultrasound Centre.
This is week 6 of your pregnancy, and it's the first week of the embryonic stage. This phase of the pregnancy is a time when internal and external structures begin to form. Although organ function remains minimal at this stage, the cardiovascular system rapidly grows, and it's at this time that we can detect the cardiac or heartbeat on an ultrasound. The little disc-like shaped embryo now is transforming into a C-shaped structure and appears a little bit more human. The embryo has a disproportionately large head, and it curves slightly forward from a slightly curved back. The nose, the eyes, and the ears are starting to appear. Black dots appear where the eyes and the nostrils are forming. The eyes are set very widely apart, and there's small depressions on the side of the head where the ears will form. Little arm and leg buds are forming. The tissue that will later become lungs has already appeared. The intestines are forming, muscle and bone, and the heart is beating about 100 to 135 beats per minute, and the circulation is flowing throughout the whole embryo. Right now, your baby is about the size of a lentil. At the end of the 6th week, the umbilical cord forms, 2 arteries and one vein, and they're molded together by a substance called Wharton's jelly and covered by amnion. Did you know that we share 98% of our DNA with chimpanzees? We share DNA with animals, flies, even daffodils. Only 1.5% of our DNA make us human. At 6 weeks, we can detect whether or not you're carrying multiples, twins, or triplets. With our modern new technology of ultrasound, we can see at this early stage whether you're carrying twins. If on your mother's side there are twins, it's more likely that you will have twins. For some reason, twins on the father's side seem to have less influence. This is week 6 of your pregnancy, and you may already be feeling moody one day, joyful the next. These are all normal feelings and are partly caused by fluctuating hormones. It's really important at this time to get plenty of rest and plenty of exercise and eat a really well-balanced diet. You may feel nauseous, and if so, concentrate on foods that you think that you can keep down. Some foods to avoid at this time are raw or undercooked eggs, pate, undercooked meats, swordfish, shellfish, liver, cheeses such as brie, camembert, and blue vein cheese. The reason that we ask pregnant women to avoid these foods is because of the risk of salmonella, coliform, toxoplasmosis. It is better for you to concentrate at this time on foods that contain calcium and iodine, folic acid. Folic acid is really important to take, especially during the first 12 weeks of pregnancy when the neural tube is developing. Iodine is important for the development of baby, and iron is important for red blood cells. If you haven't already made an antenatal check with your healthcare provider, now is a really good time, because it's important that you're checked regularly to ensure your health and that of your babies.
Thank you for watching. If you're looking for a medical or maternity ultrasound scan, we can help. Since 2007, Ultrasound Dimensions has been trusted by over 31,000 patients and doctors. Our Enterprise Ireland award-winning team offers you convenient appointments, immediate results, and always takes the time to give you peace of mind. To schedule your appointment, contact us today.